afternoon, everybody. My name is David. I'm a practicing special care dentist. My partner, Xueshi, she's an epidemiologist and data analyst in the Ministry of Health Holdings. Together, we are Team POCI, Professional Oral Care Interventions. Pretty gruesome pictures after lunch, right? So on the top there, you have infected bone with pus. On the lower, you have extremely shaky teeth. And over here, you have severe gum disease that we tend to only see in third world countries. Is this a common sight in our elderly? Well, these pictures are taken from some of our Singaporean seniors. And through our screening activity with 2 different nursing homes, we have anonymized their names, we found that oral health is really poor. For example, there's only about 5 to 8 teeth left per resident. You need 20 teeth to eat properly, to swallow, to enjoy the food, to get nutritious food. And beyond that, they have multiple extractions that's required. So, how do their teeth come to this state? Well, it's a mix of poor oral health knowledge and a long period of neglect. But another reason is because our nursing homes are facing manpower difficulties, particularly during the COVID-19 period. And through our interviews, surveys, and workplace observations, we have found staff turnover rates of up to 80% over the last 2 years. They report very limited time for oral care provision on top of medical needs, administrative work, and they found that even if they can attend healthcare, oral care training, the problem just stems beyond training. So why are we talking about these small tissues and making a big issue of it? The reason is oral health contributes to diabetes mellitus, cardiovascular disease, stroke, Alzheimer's disease, and last but not least, pneumonia. And we know that pneumonia is the second leading cause of death in Singapore. So imagine poor oral hygiene causing death. All right, this is not just a simple disease. It's a high-cost disease to both the patients, to the healthcare system. There's great environmental impact, very high carbon footprint because of the long hospitalization and the intensive care that's required. And that's not the end of the problem, because in 30 years' time, when we have 3 million seniors, at the peak of our silver wave, we'll be facing even more pneumonia, more deaths, and more hospitalization. So, what do we do to plug this gap? So, our team's answer, POCI. It's a novel service model to reduce pneumonia and chronic disease simply by improving oral health, and no one else is doing it in Singapore. So what do we do with it? Once a week, a care provider goes down to the bedside of the resident, of the nursing home resident, particularly those at high risk of pneumonia. They provide a series of oral care services such as high-quality oral hygiene. They clean the denture, they disinfect the mouth, they promote various oral functions by providing rehabilitation exercises. And studies have shown that this reduces annual pneumonia rates by up to 61%. That's a staggering number. So who are we bringing in as care providers? So we are going to recruit a very strong group here, a group with huge untapped potential. They are the inactive healthcare professionals. Many of them are displaced during the COVID-19 period. For example, during 2019, 15% of oral health therapists are no longer in active clinical practice. And not just them, but also nurses, active freelancers like healthcare retirees, and the nursing home residents are not the only beneficiary here, because by providing an employment option that's flexible, practical, and dignified, we help both groups here. So how do we know this will work? We have already gained traction over the past 2 years providing POCI in various settings, in nursing homes, at people's home, on the dental chair, on the bed, so on and so forth. And we have already confirmed at least 2 nursing homes who will be working with us, and also the Association of Oral Health Therapists Singapore and the Chiji Foundation. We'll utilize our strategic positions, for example, sitting on the AIC Training Advisory Panel, MOH GSDC work group, and so on, to further understand the needs of the nation as a whole as we scale. So, what will we be doing differently for YAC? We'll be measuring health impact, before and after measures of blood sugar measures and nursing home feedback. And with that, we are asking you for $30,000 mainly to remunerate the manpower. And with this, we are looking at a huge benefit for this 42 nursing home seniors over the length of 6 months. For example, preventing 16 episodes of pneumonia, avoiding 124 days of hospitalization, and saving the healthcare system and taxpayers $110,000. Imagine if you plant the seed today and it grows over the next 30 years to reach all the seniors in Singapore. We are looking at staggering benefits like avoiding 5,000 overdeaths per year and saving the healthcare system $190 million every single year. So please support POCI because small tissues cause big issues. Thank you.
Thank you very much, POCI. So we'll have the judging panel for the Q&A session.
Yes.
Much for your idea. I was just wondering, you mentioned that the main portion of the 30,000 would be going to pay the manpower
Yes.
of 3 packs. So I believe that those are the professionals who would be going down to the nursing home, right? But
Yes.
how about the administrative side of things?
I will be doing, me and my partner will be doing it. So it will be on a voluntary basis to get links to tie the care providers and the care recipients. So on our end, we'll do that. And it won't be paid. I don't think we can pay ourselves through this. So, but it's meaningful work, so it's something that I'm keen to do.
I would just like to share that I would like you to think about it seriously because we don't want you guys to get burnt out. Because for a program like this, I think it's very useful and then it can go a long way. And you need to make sure that you don't get burnt out first. So maybe you can think also, in parallel to recruiting your professional manpower, maybe you can also consider recruiting volunteers to help you manage the administrative sides of matching the supply and demand of your services.
All right.
Yeah.
Thank you for the comment. I'll take note of that, not to burn out.
If I may, yeah? Is this on? Hello?
Yes.
There, thanks,
I'm
David and
hearing you.
Oral health is certainly a very important part of aging well. If I may ask you to just elaborate on 2 further areas.
All right.
One is on the sizing of the problems, and then the other one is on the further details on the barriers to plugging the gap. So I think you would have just touched on them in the presentation. Could you deep dive a little bit? So on the size of the problem, what exactly is the addressable market that actually suffers from this level of dental health deterioration that requires this intervention? You have some global numbers at the back, but if you were to zoom in on what exactly is the addressable market, what would be the size of the problem? And the second one is on if we could understand better your sensing on the barriers to plugging the gap. I mean, what is preventing our seniors today, whether in the nursing home or in the community? And I suppose beyond nursing homes, depending on how you size the problem, you also want to reach out into the community and ensure that seniors in the community also stand to benefit from programs such as this. So do you, what are your further insights as to the barriers to plugging this gap, both in the nursing homes as well as broader in the community? And how do you see efforts to get a better sense or a better handle of what these barriers are, because that informs your strategy and your responses? Thanks.
Okay, thank you for the question. I think it's really valuable and it's something that bugs me a lot of days, as in during my work. And sometimes, as a dentist, sometimes we are not able to split ourselves and go across different areas to plug this gap. Firstly, on the size of the problem, these are just some figures from the nursing homes that we have done dental screening. So this is our local nursing homes. We have anonymized their name to protect. And if you can see, there's actually a very high dental need. But beyond just seeing dentists, particularly those category 3 or category 4. So for those who are not aware, those category 3 and 4 residents tend to be of very high dependency needs. That means they can't brush their teeth. So this group, this size, this group of seniors, very vulnerable within the nursing homes. Those in the community, I think they are better, they are less dependent, and oral hygiene, oral health is tend to be better. I cannot really put a number to this, but there are three other local studies that reported different numbers, and the numbers are quite close, but we are using our own data over here. So we are not very sure of the whole size of the problem, but it seems like there's a key group in every single nursing home. Okay, as for reaching out to the community, it's possible, but in terms of operational work within the nursing homes, it's when we have tried this and run it, we realize that it's more feasible because you want the manpower to see, to cater to, let's say, 14 seniors within a day. But for the community, it doesn't really make sense if the care provider goes to different house, and there will be a lot of traveling time in between. As for the barriers, I would say every single nursing home is very, very different, very heterogeneous, there are barriers. It's beyond these 2 nursing homes, we have went to a few others, and these are some of our needs analysis research. So beyond this, manpower constraints is one issue, but also for our seniors who come from a very tough background, or pioneer generations, their oral health knowledge and the care over the past few years, for the past decades, is just not there. So I think it's a mix of both. And we expect that as people become more dependent, they are less able to take care of their own teeth, and hence you have all these oral diseases and pneumonia and health-related issues.
All right, thank you very much. So the time's up. So
Okay, thank you.
Thank you very much for your presentation.